Thank you, everyone, for joining Minister Luan, the Associate Minister of Mental Health and Addictions, Lorette Garrick, CEO of the George Spady Society, and Dale McPhee, Chief of Police for the Edmonton Police Service. Minister Luan will announce new initiatives that will increase treatment and recovery beds and help prevent opioid overdoses. Without further ado, Minister Luan.
Thank you, Justin. Good morning, everybody, and thanks for joining me today. I'm pleased to be here with some amazing partners who have worked very hard with Government of Alberta to help people living with addiction by ensuring they have access to the best programs and services in Alberta. And thank you to Loretta Garrick, Chief Executive Officer at George Spady Society, and Dale McPhee, Chief of Police, Edmonton Police Services, who will both provide remarks shortly. As you know, Alberta government has made it a priority to ensure people living with addiction have access to top quality care and a full continuum of services from prevention, intervention, treatment, and recovery. This includes services to reduce harm, which is an integral part of the road to recovery and an important piece of our government's commitment to high quality and easily accessible service care for people who struggle with mental health and addiction. Tragically, we have been reminded of the vital importance and urgency of this work with the recent apparent overdose deaths here in Edmonton. 3 overdose deaths in one afternoon. 1,144 deaths for Albertans in 2020. My heart aches for the friends and families, for those who have died, and everyone who have experiencing the loss of a loved one. Each loss is too many. And that is even a stark reminder to us, we must remain absolutely committed to do everything we can to address addiction in our province. I am committed to working closely, as we have already been, with our stakeholders. Of course, we'll continue this important work in other communities across the province as well. Opioid crisis is a tragic and a complex issue with no easy answers, but more can be done. And more is being done as we speak. Alberta is implementing a recovery-oriented system of care to transition our addiction and mental health system to a patient-centered, integrated part of healthcare system. This model is built on the belief that everyone has a right to be supported in their recovery and face as few barriers as possible to treatment and help. Albertans deserve no less. People with addiction deserve no less. And so today, as part of this ongoing priority work, I am pleased to announce 2 important initiatives that will improve access to overdose reversal drugs and also improve access to treatment and recovery. First, starting June 15th, people in the Edmonton area will have access to Nasal Naloxone Kit that can help temporarily reverse the effects of opioid overdose. With $1.5 million from the province, George Spady Society, in collaboration with many partners in the province, including police and Alberta Health Services, will lead this 1-year pilot program to provide nasal naloxone kits in the Edmonton area. Initially, people at risk of experiencing or witnessing an overdose, an opioid overdose, will be able to go to Edmonton's George Spady Center to access one of these nasal naloxone kits. More distribution sites will be added in the community as the project unfolds. Nasal naloxone is a type of naloxone that is sprayed into the nostril of someone suspected of overdosing. Instead of injecting the naloxone into that person with a needle, this one just a spray to the nostril. Nasal naloxone, as you can appreciate, is much easier to administer as well as there's no risk of needle sticking to somebody's arm. One nasal spray is approximately the same as 5 injectable naloxone kits, making it a lot more effective. If the drug is administered right away when an overdose is suspected, naloxone can get the heart started and the person breathing again so that they can immediately seek emergency medical care. This project will complement the existing provincial naloxone kit project, which provide injectable naloxone across Alberta to people who can help someone experiencing overdose. The program has provided more than 350,000 injectable naloxone kits to people across the province since January 2016. Nearly 26,000 overdose reversals have been self-reported, meaning thousands of lives have been saved. Over the course of the next year, the new pilot project will evaluate the impact and the benefits of providing take-home nasal naloxone kit. But by the time of next summer, thanks to this project, we hope that we will better understand if people prefer using this nasal naloxone kit over the injectable, and what's the effectiveness of this pilot, and how can we roll this over to a provincial-wide strategy. So I can't wait to that date when the research completed, evaluation come with such recommendations. The second announcement for today is Alberta's government has committed another $2.1 million over 3 years that has allowed George Speedy Society to open 35 medical detox beds. Medical detox beds offer medical supervision and medical support to people who need it while they are detoxing from drugs. It can include providing medications to help people with severe withdrawal syndromes because they have become physically dependent on this substance. These additional beds means that 4,550 additional Albertans will have the opportunity to receive medical detox support over the next 3 years. Projects like this are crucial components to addressing the opioid crisis and keep Albertans alive so that they can access treatment, recovery, and the support that they're ready to take on. We want all Albertans to experience improved health, the mental wellness, and lead fulfilling lives. And we remain focused on building a recovery-oriented system of care here in our province. There are a number of steps we have taken so far I'd like to highlight. Last November, Alberta became the first province in Canada to eliminate the daily user fees for public-funded treatment facilities in Alberta, so that any Albertans who need to have this life-saving treatment can access that without worry about their income. We expanded and have no wait list for virtual opioid dependency program so that people, doesn't matter where you are in the province, including remote rural areas, you can access this popular treatment program over telephone conferencing. We have achieved the highest rate of dispensing medications, both for naloxone and Suboxone, to help address withdrawal symptoms, as well as overdose reversal drugs, naloxone. We are and will remain a national leader in taking concrete actions by creating more than 4,000 additional treatment spaces across the province, building recovery communities, developing a mobile app to help protect people using opioids and other substances while alone. And this will be available in Edmonton later this fall. Continue to support supervised consumption services in high-need communities, like what we're talking about today. And today, launching a nasal naloxone project and supporting more detox beds here in Edmonton is another step to increase our support in this area. All of this provide more treatment options and more tools to help curtail this opioid crisis. For all Albertans who need help, we are here for you. We want you to remain alive here with us and able to choose the kind of recovery path that is suited for you. For that, we'll remain committed to help you to meet your needs where you are. Thank you very much. Now I'd like to turn the mic over to Loretta to share her remarks.
Thank you, Honourable Minister Luan. On behalf of the George Spady Society, thank you for your contributions in helping to shape mental health and addiction services for all Albertans. The George Spady Society has been part of the Edmonton community for close to 40 years. Throughout our history, we have focused on providing hope and dignity and trauma-informed services and a gateway into addictions treatment services for individuals, many who have struggled with complex life circumstances and have often experienced homelessness. We have been proud members of the Alberta Addiction Service Providers Organization, and this connection has built a strong foundation to bridge services that reduce harms with addictions treatment. We all benefit when we have a strong recovery-oriented services that span the spectrum from services that reduce harms to treatment and meet people where they're at in our society. We are pleased that the George Spady Society will now have a full range of medical services available in our Detox Unit. The Detox Unit is unique as it's in the same building as our Supervised consumption services. This co-location is a real opportunity to provide direct pathways for people to access medical detox when they're ready to do so. The Nasal Naloxone one-year
Long-term effects of opioid crisis in our residents' economy and collective welfare underscore the importance of agencies such as the Edmonton Police Service working alongside government, service providers and community supports to uphold safety and well-being for all Edmontonians. Every day, police and first responders witness the true nature of the opioid crisis. The adverse impacts to overdose survivors and the families and friends that overdose victims leave behind are significant, and we must not forget. The opioid crisis does not just affect individuals, it affects entire communities, and that's something that we've seen in the recent weeks. We've seen consequences firsthand. Edmonton's downtown and marginalized communities have been hit particularly hard by this grim reality. Social issues such as addictions are complex and often intertwined with other issues like mental health and homelessness, as Lorette has mentioned. Providing a multi-pronged approach driven by human-centered services is integral to addressing the root causes and effecting lasting changes. So, Minister Luan, the recovery system that you're putting in place is very, very much appreciated, and certainly by not only your police service, by the citizens of Edmonton. So thank you. Through targeted enforcement of drug supply and production, although targeted supply of drug enforcement and production is important, you've certainly heard me say and us say many times we will not arrest our way out of this crisis. What we see here today is putting balance into that equation. It also doesn't mean that enforcement alone is going to solve the immediate dangers that some of the individuals face. And I think now having some medical beds in place to obviously treat those, and particularly with addictions. And then on the other side of this, just recently, I think it was last Thursday, that we got information that perhaps carfentanil was in our streets, and we obviously took immediate action on that, taking one of the suppliers, certainly within the downtown, off the street with a significant drug bust in relation to carfentanil. Carfentanil, just for those of you know, that's stuff that is very toxic, as we put out in our release, obviously dealt with large livestock such as elephants. So you know that the impacts of this on our streets is significant. So although we put the places in relation to the medical treatment and the other aspects that we've heard here today, we can also make sure that enforcement dovetails into those that choose to harm our community. So again, I think significant steps forward for the City of Edmonton. Evidence shows that as the key to successful outcomes is enacting solutions that span the entire spectrum, from prevention, intervention to harm reduction, treatment, and recovery. I believe the announcement today regarding the nasal naloxone, accompanied with the funding of 35 additional treatment beds, is the type of balance we need, and hopefully this will be the start of building a recovery-oriented system that is much needed in our city to tackle complex social issues. Again, today's announcement, as I mentioned, the detox bed program in Edmonton is a positive and much needed step forward, creating more comprehensive wraparound services for those experiencing addiction. The Edmonton Police Service is also hopeful that the participation of the Nasal Naloxone pilot will assist in strengthening our city's response to the growing crisis. And as Lorette said, it's not just handing it out. There's going to be an evaluation to making sure that we continue to try to get this right, to get the right, obviously, services to our citizens. As emergency responders, police are among the first on scene of a possible overdose on many occasions. Our ability to respond quickly and appropriately is fundamental to preventing further harm and, in many cases, death. Overdose is not limited to those who suffer from addiction. The addiction of fentanyl to other illicit drugs also puts recreational users at risk, often unknowingly. The more tools we have at our disposal, the more lives we can potentially save. We look forward to working with our partners on the nasal naloxone pilot and seeing larger impacts in the overdose prevention in our city. Again, I think this is what we're seeing is a balanced approach, something that we've needed for quite some time, and I appreciate the action. We look forward to the steps further to this, to getting some more done on the ground. So thank you very much.
Thank you, Chief McPhee. We'll now move over to the phones. If you want to ask a question, Minister Luan, Lorette Garrick, or Chief McPhee, reporters will get one question and one follow-up. So, operator, could you please put through the first caller?
Kyle Moore, Kicks FM.
Hi there. My first question today is for Minister Luan. In regards to the supervised consumption sites, which I believe was mentioned there a little earlier, why did you bring in the quality standards for those supervised consumption sites?
Thank you. Good question. This is a follow-up to our extensive supervised consumption sites review. Took provincial-wise, with 19,000 Albertans participated in it. If you recall, at the end of that review, it concluded the service as is chaotic, with no standards, no consistency. We must do something about that. So since then, we've been working around the clock, comparing best practice around the world, digging into what's best Albertans can do, and came with this what we call principle approach, with professionalization of the standard of supervised consumption site services, and integrated that part of the work into the whole house care system. So truly what we're doing is demonstrating we're taking addiction as a house care issue. We're providing standard care that Albertans so deserve.
And Kyle, do you have a follow-up?
My kind of a follow-up here is around the kind of addiction strategy. Why did you focus your addiction strategy on recovery?
This is a significant new direction that since we took office, Premier Jason Kenney announced the early days that our approach is going to be focused on getting people well, getting people live in a state of recovery so their life is a life full of pride and purpose versus to being driven by addiction, driven by drugs, and leading a life out of challenges everywhere, from losing family, losing jobs, losing life eventually. So this is a new direction we're taking, and what we call is a recovery-oriented continuum care model, and many people say this is Alberta model, so we're proud leading our country in this way.
Thank you, Kyle. Operator, will you please put through the next caller?
Dave Kaiser, 660 News.
Good morning, Minister. Now, there's been some speculation for a while here, especially with the announcement the Schumer's closing, that we might be seeing every existing supervised consumption site either closed or kind of relocated out of the way. Just wondering if you can give any sorts of reassurances there.
Thank you. Thank you. It's an important reassurance that I've said over the last couple of weeks, but I'll say it again. We're not closing. We are replacing the existing ones that is not doing what it's supposed to do with new ones. The Calgary one example is we're planning to close Schumer site, but we'll open 2 more. We're not going to close the existing one until the new ones are in place. So it's a transition from the old chaotic service with very little structure into it, into a professional standardized service that is integrated into our existing services so that people don't have to travel, make it easier for them. And the George Speedy's example today is another example. By having supervised consumption site services there, detox there, and treatment available there. So we are demonstrating to folks that we're taking concrete steps, build this Alberta model that is a full continuum care approach.
Safe, do you have a follow-up?
Yeah, I do. I'm just wondering, Minister, do you feel that nasal naloxone kits are enough to kind of stop the spike of overdoses here, and do you plan to launch similar pilots elsewhere through Alberta?
Yeah, our intention is this. As you can see, this is a new technology, a new way of a new tool in our toolbox. We wanted to pilot it in Edmonton region with the hope that by end of this pilot, we'll have first-hand knowledge, information, data, evaluation, and recommendation come back to us if we want to roll this out to the whole province. What needs to be happening. So I'm looking forward to this pilot and looking forward to its findings coming back to us.
Thanks, Safe. Operator, can you please put through the next caller?
Chad Culvern, Lakeland Connect.
Hello, Minister. I'm just wondering, what's the plan for for mental health for Albertans?
A great question. As you can appreciate, with COVID created unprecedented health and social crisis, the mental health impact to virtually every Albertans has been felt and experienced by many. Because of that reason, early, I think March last year, we stepped up to the plate. We responded with a comprehensive 53 million COVID mental health and addiction action plan. With that, we have drastically increased accessibility for mental health and addiction. I believe 21 million was allocated for that first bucket, drastically increased addiction crisis line, mental health crisis line, kids helpline, text for hope, virtual therapy, 211, you name it. As a result of that, as of today, doesn't matter where you are in Alberta, 24/7, you can access mental health support services that way. So that's one part. The second part is 25 million of that 53 million went to what we call COVID community grant, because we know government alone cannot overcome this crisis. We need to partner with the communities. We need to leverage their existing relationship and network so that we can help each other during this difficult COVID time. It is rightly so. Over 1,000 of organizations responded. In the end, 233 succeeded in that. And as we speak, they are providing ongoing support to provide mental health support to their residents and citizens while maintaining the health measures that we need to curtail the spread of virus. So I want to take this opportunity to thank all of them for their contribution. Because of their service and their creation, I think Albertans are able to rely on them to meet their needs.
Chad, do you have a follow-up?
Yes, I do, please. With addictions rising, and I know you've addressed the public care facilities, will you guys be looking at helping support private care or helping the addict with the private care facilities as well?
At this point, our focus has been having the public mental health and addiction system tailored into this full continuum care model with focus on recovery. We haven't done much in terms of the private treatment part, but my hope is this. It takes a village to raise a kid, and it takes all of us to contribute to overcome the opioid crisis in our province. So I welcome the additional contributions from the private sector. For those you can afford having the private care, please do so, because your access to that system will alleviate the pressure on the public system. So in the end of the day, I think we ought to put all our effort together and win this over.
Thanks, Chad. Operator, can you please put through the next caller?
Liam Verster, Everything GP.
Hi, good morning. This is a question for Mr. Luan. With looking at the figures here, I see that Edmonton and Calgary in total have sort of the highest overdose rates, but comparing that to the per 100,000 people, it's on the lower end. So why did you choose to pilot this project in Edmonton and not somewhere like, say, Grand Prairie or Lethbridge, where the rate is much higher?
Thank you very much. I totally understand your desire to advocate this be available to any other communities, including Grand Prairie and Calgary. Let me tell you this. My sense of urgency and my hope of spread this sooner is the same as you. But we ought to do it in a way that is meaningful and tangible and manageable. So that's why we took the approach of do a pilot first, and then we roll it out provincial-wide. The reason for Edmonton, partially because the demand for naloxone kit in Edmonton region, according to my recent briefing, is relatively higher than other parts in the province as we speak. And the recent overdose deaths that occurred in the Edmonton region also causing residents in this region a lot more concerned, what can we do? So I think those two, plus the partners here, police and service providers, are a lot more ready. They already meet and discuss and are ready to take on actions. So because of all those reasons, we thought the pilot to start here is well grounded.
And Liam, do you have a follow-up?
Yes. So with this pilot, what is sort of the timeline then? When should we be expecting to see some figures come back and see whether or not this will be expanded through the rest of the province?
The project will start August this year, anticipating close next year by August. If we can accomplish our goals sooner, I'll take it.
Thank you, Liam. Operator, will you please put through the next caller?
Emily Mertz, Global News.
Thank you, Minister. Late last month, Boyle Street Community Services requested these additional kits, naloxone kits, but they also asked for an emergency coordinated response and command center to the overdose crisis involving stakeholders like police, AHS, the province. and also quicker and more fulsome data about overdoses, specifically locations where they were happening. Have you had discussions about those requests as well, and where do they stand?
I think today's announcement, in part, is due to advocacy from what you just mentioned there, and many other from our province. Let me put it this way. I very much appreciate the care and the compassion many of our communities and service providers have on this. And because of your compassion on this, it encouraged us, my office, that we work around the clock nonstop to continue build on the services and creative new ways of doing things to meet the needs. So I want to take this opportunity to thank them all.
Emily, do you have a follow-up?
Yeah, I just had a follow-up regarding the new policy guidelines for supervised consumption services. Just to clarify, could someone go to a site and receive services if they do not have a health care card or other type of ID?
The short answer is yes. It's a subject that was debated in lengthy discussions and incorporated that procedure into the guideline. Because our intention of using healthcare number is to have a way of tracking the services and also retrieve the record that we had before. Like anybody entering into a healthcare system, it helps to quickly access the situation and have proper response for accurate, more relevant response. But we also recognize for this population, sometimes they don't have fixed addresses and our healthcare number is not there at all. We made a decision that no service will be refused because we don't have those numbers. Instead, the service providers must have staff assisting people who don't have the card so that there's a way they can get it. So that is being built into the guideline.
Thanks, Emily. Operator, will you please put through the next caller?
Janet French, CBC.
Hi there. Thanks for taking my question. I mean, in light of reports of a recent spike of overdoses in Edmonton, local leaders and organizations have been calling for better access to supervised consumption sites and clean needles. So I guess for both the Minister Luan and for Chief McPhee, why do you think this announcement is what people really need right now?
I can take a stab at it and then I'll give it to Chief McPhee. My thinking is this, as we referenced early, addiction is a complex issue. How to find solution for it, it takes all of us, our efforts to do more and to come up with best practice to respond to it. Today's announcement is another demonstration of our government of Alberta's commitment, wanting to find solutions, wanting to work with our partners to create tangible solutions for this. Is this all it takes? I'd say no. More is required. But we have to get started. We have to demonstrate our concrete steps moving toward that full continuum care model so that people can have choices. And when they can, when they are ready to take actions into their journey of recovery, they can find the appropriate support services that match their needs. So that's our intent. I'm going to turn it to Chief McPhee to add further comment.
It's a great question, and just to complement what the Minister said, I think there's a few angles in relation to that. I think it goes back to the question before about using the data. You know, certainly some of the data that we've seen and been privy to is a lot of these overdoses take place behind closed doors in residents owned by citizens or residents owned by perhaps friends. So I think it's important that that piece that Lorette mentioned about recording the information is critical to actually figure out what you're trying to solve. I think it goes on to another couple other pieces too, is the nasal naloxone, from what we've been told, and certainly understand through some of the folks in our place that looked at it, is easier to use for a person that might be experiencing a medical episode, meaning that they perhaps could use it on themselves sometimes, where the other kits might not be able to. So again, it's taking chunks and bites out of these things at every step along the way. And then the other piece to this is why I think it's so critical is we didn't have any medical beds. Now we'll have 35. And so it's not so much that they're just getting the treatment. Obviously, you have to be able to keep them alive to treat in relation to those people in stress and crisis. But this is that complement, as the minister said. And I think what certainly resonates with us as the police service is we're starting to look at a continuum of care that's invested in all pillars. So we got prevention, intervention. Obviously, part of that is safe supply and safe consumption, but it's not the only thing to focus on. And so I think this is why we think it's a critical step and going forward. And I think that measurement piece coming along with that as we go will actually help us understand the piece of what we actually are trying to fix. What we like most about it, and the minister said that several times, is recording this information actually makes this a health issue and a health crisis, and that's where we have the most chance to succeed. And certainly as a police service, we're prepared to get underneath that to do whatever we can to help with that.
Thanks, Chief. Janet, do you have a follow-up?
I do, for Minister Luan. So critics say that your government is adding red tape to supervised consumption sites, requiring these good neighbor agreements, these protocols that need police approval, and requirements to collect clients' health numbers when they have them. But meanwhile, your own statistics show that in the first quarter of 2021, opioid poisoning deaths were double what they were in 2020 and higher than any first quarter on record. Why would you put up more barriers for the operation and access of supervised consumption sites now at a time when more people are dying?
Let me respond in two points. The first point is regarding to your concern for red tape. Like we demonstrated already today, we're taking a balanced approach. So standard of care is required, but we are also mitigating that. It's not become a barrier for access for service. Like you heard me talking about regarding to Alberta healthcare number, how we are medicating that. So it's the same spirit. We cannot take it from a single pillar, one perspective approach. Just say, if you request this, you just added more challenging. There are ways to managing all of this, and we need to take a comprehensive multi-pillar approach in approaching such issues. So that's my response, number one. Number two, you talk about the increased opioid deaths. It is absolutely true. COVID has made such a significant impact for that. Not only Alberta, but BC, Ontario, Quebec, across the whole jurisdiction in Canada and worldwide, COVID has made that impact. And if you compare relatively how much increase that has been, some provinces in Canada has increased more than 50%. I think we are at the 40% level, relatively lower in that regard. That's not to say this COVID has put us in an even higher degree of challenging, and that put us at a spot that we need to think creatively. We need to go out of the box and get the best of the best available to respond to this. And I am very proud to say that our Alberta model has been taking notice across the country. And the way that we focus on recovery, we focus on getting people living well as our vision. And by creating a full continuum care model that created openings for people, doesn't matter what part of your journey, when you're ready, there's something can be available to help you get into the healthcare system. Is something leading the country, is being taking notice across the country. Our Premier and I shared the Alberta model in the Council of Federation. This is the Association of Premiers among Canada. And Alberta model was shared there. Premier opened the concept of how this recovery-oriented continuum care looks like. And we went on, shared about the steps we've been taking. Many service providers, I believe about 5 or 6 of them, also joined the conversation, shared their experiences. It was viewed as one of the best promising practices currently exist in Canada. And I am so much looking forward to working with all of you, all of our stakeholders, to continue build that Alberta model, continue build that full continuum care, make sure that Albertans will enjoy world-class addiction and mental health care system.
Thanks, Janet. We have time for one last question. Operator, could you please put through the next caller?
Catherine Grogowski, Alberta Today.
Thanks for taking my question. So this question will be to the minister. Chief McPhee talked about the toxicity of supply on our streets. What, if anything, is the province going to do to address the need for a safe supply?
I will open up the question. I'm going to hand it over to Chief McPhee after that. I know from our government point of view, we're taking a multi-pillar approach. We also added resources in the police forces. I believe the alert program, we doubled the funding since we took office. And Minister Schweizer and I made an announcement in Red Deer and Lethbridge for stepping up to that program. The example early, Chief McPhee mentioned about they busted the illegal drug supply in Edmonton is an example that when we accelerate the resource and the forces behind that, it gives us more tools to curtail that. But this is Chief McPhee's field. I'm going to turn this over to you.
No, it's a great question, and I think what you're hearing here, it's a balanced approach. And when we talked about safe supply, as you referred to it, I think what you're talking about is my comments in relation to carfentanil. Carfentanil on the streets is dangerous wherever it is, and it's unfortunately going to kill people. So what's the only thing that's going to stop that is to take the supply out, and that's where the enforcement piece comes in, where you focus on the supplier, because it's that potent. It's extremely dangerous. There will always be new types of drugs hit the street, and having current information and the ability to try to stop that from hitting those of our vulnerable population and those that feed off that obviously try to sell that and make a profit off it, we need to take those sectors out, as the minister said. And that will exist forever. And I think what you've also seen here, and certainly play out in some of our communities, certainly in Edmonton, is meth in particular is cheap. And when it's cheap, people are going to push it out. It's largely led by organized crime. It comes from other parts of the world. And those are also things that we consistently work at, not only on a provincial basis, but on a national basis. So when the minister mentioned putting resources between himself, Minister Madhu, and others into the alert program, that operates on not only just a local, but it operates on a provincial, a national, and an international perspective. So we're always trying to take out those cells. Those are the people that obviously choose to create harm by selling these type of products on our street. And it's important that we do that. But I think we also can't be fooled by just thinking that if we legalize that goes away. If you look at the Portugal model, it's important that you have supports in place in relation to be able to treat that. And an example that we had in that's obviously a lot less lethal, but you know, when marijuana was legalized, it didn't change a whole bunch in relation to the supply that hit the streets. So I think it's just important to Minister's point that we're always on top of this, and the way you stay on top of it is current and relevant information where we can share it when it's hurting people on our streets, so we can address it quickly.
And Catherine, do you have a follow-up?
Yes, multiple, but I'll stick to one for now. Minister, you'd mentioned that when the Sheldon Schmear site is closed, two will replace it. When will we know where those sites are and when they'll be open?
Our plan is to share this new approach, principle-based approach, as a direction, and then we're going to take time to work with stakeholders and have a proper process so that those who are interested in play can apply and discuss with us for funding for such programs. Our intention is this. We will take down the so-called centralized large super site. We will replace that with smaller sites, but fully integrated into existing services. For example, I'm just using example, I'm not making decisions. Alpha House and Calgary Drop-In Center, they're already providing all kind of support service for the homeless population. By adding this supervised consumption site service within that, people don't need to travel. You just get the needs that you needed get the services that you needed, and without causing any unintended community harms to the surrounding community. So that's the approach we're taking. And another part of that is by integrating such services into existing support, we're providing that. I think Loretta and Chief McPhee mentioned about wraparound services. We go where clients are, and we make it easier for them. So those are all part of our principles. But we want to respect our community partners' readiness and willingness and how much they want to play this and so on and so forth. We want to take time to work it out with them, with a goal that by end of this year, we would like to see this transition completed. Because people's lives are depend on such critical services. In one hand, we want to get it right. In the other hand, it's urgent. We need to get on with it.
Thank you, everyone, for joining for this news conference, and have a great day.